When we talk about age-friendly healthcare, it's a focus on the 4 M's. What matters? Share your goals and priorities. Medication. Review all the medications you take. Mentation or mind. Talk about your memory and mood. And mobility. Ask about ways to help keep you active and moving. To see age-friendly care in action, WebMD and the John A. Hartford Foundation visited 3 age-friendly health systems.
Terry, we talk a lot about age-friendly care, but here we're on an adventure that we said we would take for quite some time, where we're going to go out and see age-friendly in action. So tell our viewers where we're headed.
Here we are at the University of Utah Medical Center, where they are a premier location for age-friendly care. We're also going to be visiting a Minute Clinic, where they've made a commitment. 100% of their clinics are age-friendly.
100%.
100% using our 4M framework. And the Veterans Administration, the VA Health, which is also 100% committed to age-friendly care.
So we're going to see some of the best examples that hopefully viewers will say, that's the type of care that I should get if I'm not getting it.
And what we say around the country is, you deserve age-friendly care. You should demand age-friendly care.
We're ready to go.
Dr. Whyte, good to see you.
Thanks for hosting us today.
It was a pleasure.
And we understand that you saw a patient earlier today and that you were practicing your age-friendly healthcare, and we want to hear more about that.
So, in my view, the 4 M's are a bundle, and once you start asking about one of the M's, you inevitably sort of start shifting over to another, and so it's sort of this beautiful tapestry where you really have to consider them all and ask about them all in order to understand the big picture for the patient. I'm going to ask kind of a big question, because it's important for me to understand what matters most to you for your care, because that way I can align your care plan with what's most important to you.
What matters more to me?
So yeah, what I'm thinking about are things like, not just with your health care, but what matters most to you in your life.
My family, and I got good family.
What matters piece, I consider it to be the North Star of age-friendly care, where everything sort of flows from. I understand from the medical assistants that the medication list has not changed since last time. Probably the one I want to make sure that I ask you about is the trazodone for sleep, to make sure that you're able to tolerate that without feeling groggy or dizzy in the morning. How's that one going for you, the trazodone?
The one that you take for sleeping, Dad, are you feeling like you're doing okay with that?
Oh, yeah.
So if you're going to go down a sort of a pathway of giving someone a medication, but you don't ask about what matters, or mobility or mentation, you may be doing something inappropriate, even though it looks as though you're being more efficient. We've talked about a number of things, but do you ever forget a meal, or forget to sort of prepare something for a meal?
Do you ever feel like you're forgetting to make something to eat, or?
Oh, no.
I feel like my dad has a great memory. He has a great memory for things a long time ago.
That's my next question.
Yeah, and even, things that he needs to remember to do.
It's very important that we assess your walking today, so we'll look at how you walk and how you balance today. I definitely want to do that as part of our exam today. I'm going to have you stand up with your arms crossed if you can. Okay, and I have you put your arms down. Yep, just put your arms down.
See, every time I get out, I gotta be careful, because I don't know how my legs are gonna feel.
Did you feel dizzy when I had you stand up just now?
Did you feel dizzy when he had you stand up, Dad?
Huh?
You didn't feel dizzy when he had you stand up?
No, I didn't feel.
I'll just have you walk to the door and back if you feel comfortable doing so.
See how I'm just being conscious there.
Okay. I think one way we know that patients are receiving age-friendly care is they actually are doing more of what they enjoy, and they're doing less of what I call healthcare homework.
And we look forward to your progress. Thanks for being here.
Thank you.
Great.
When used together, the 4 M's can help manage your care in ways that are unique to you. Ask your healthcare team for age-friendly care. Learn more at webmd.com/age-friendly.